Hello everyone and welcome to the channel. If you are a healthcare professional, a nurse, CNA, caregiver, medical assistant, social worker, or someone working inside healthcare, this video might completely change how you see your career. Because today I want to talk about something most healthcare workers are never taught, and that is the ownership side of healthcare. Now before we get into this, let me say something real quick. This video is not about quitting your job tomorrow. This video is about understanding an opportunity that already exists inside the healthcare industry, an opportunity that many people overlook simply because no one ever explains it to them. So if you're someone who has ever thought there has to be more than just working shifts forever, then this conversation is for you. Now let's talk about the reality. Healthcare professionals work incredibly hard, long shifts, emotional labor, physical labor, and often the pay does not always reflect the responsibility you carry. And for many women in healthcare, especially mothers, life can feel like a constant cycle of giving. Giving at work, giving at home, giving in relationships, giving to everyone else. But at some point, many women reach a moment where they start asking themselves a question: what would it look like if I started building something for myself? That question is actually what led me to start studying the licensed care home industry, because what many people don't realize is that licensed care homes are actually part of the healthcare system. These facilities provide housing, supervision, and daily support for individuals who cannot live completely independently. And because the population is aging rapidly, the demand for these facilities continues to increase every year. But here's the interesting part. Many of the skills required to operate these facilities are the same skills healthcare professionals already use every day. Understanding patient needs, documentation, compliance, care planning, staff coordination, and understanding safety protocols. Healthcare workers already understand these things. What they often don't understand is how the business side works, and that is the gap. Now let's talk about something else that is important. Licensed care homes are not just houses where people live. They are regulated environments. Operators must follow licensing rules. They must follow health and safety regulations. They must maintain documentation, and they must pass inspections. In other words, this is structured healthcare infrastructure. And when people understand that structure, they begin to realize that healthcare ownership can look different than what they imagined. Now, I want to speak directly to the women watching this, especially the healthcare girlies. The ones who have been holding everything together, working, raising kids, navigating relationships, trying to build a life, because I know what that journey can feel like. For many women, there comes a season where you start realizing that you deserve more than survival mode. You deserve growth, you deserve stability, and you deserve ownership over the direction of your life. For me personally, there was a moment where I decided that this season of my life was about choosing me. Not in a selfish way, but in a growth way, in a I'm done playing small with my potential type of way. And sometimes choosing yourself means learning about opportunities that no one ever explained before. Licensed care homes happen to be one of those opportunities. Now, does that mean everyone watching this video should open a facility? No, but what it does mean is that healthcare professionals should understand the full landscape of their industry. Because once you understand how the industry works, you can make informed decisions about your future. You may decide to stay in your role. You may decide to move into leadership, or you may decide to explore ownership. But the key is education, and that's what this channel is about, helping people understand how the healthcare ownership side actually works. Because when information becomes available, possibilities expand. So if you're someone who works in healthcare and you've been thinking about your next level, this might be the start of a conversation worth exploring.